All right, good afternoon, everybody, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you, Kelly, and good afternoon, everyone. Today marks the 6 months since our first confirmed case of COVID-19 in Philadelphia. For the last 6 months, our entire city has been responding to the pandemic with a focus on protecting the health, safety, and welfare of all residents. This has and will always be our first priority. But as we saved lives, flattened the curve, and began reopening with care, we also focused on recovering from the devastating economic crisis that the pandemic created. You're already aware of the impacts COVID-19 has had on our city finances, forcing us to cut $750 million from the fiscal year 2021 budget practically overnight. You know that Philadelphians are struggling, and we're on the precipice of a housing crisis if we don't continue to act with urgency to keep people in their homes. You also know that businesses of all sizes are struggling, with some sectors having been hit harder than others. Earlier today, Visit Philadelphia, the Philadelphia Convention and Visitors Bureau, and the airport released a bittersweet update on our tourism industry. It shows how 2019 brought record visitation to our city and region. And then the pandemic devastated our local hospitality and tourism sector this year, one of our hardest hit industries with tens of thousands of jobs lost. I am confident together with Visit Philadelphia, the PHL-CVB, Pennsylvania Convention Center, and the entire hospitality industry, we will rebuild and help put people back to work. And to that end, today I want to talk a little bit about economic recovery. We're releasing a report today called Respond, Restart, Recharge, and Reimagine, which gives an overview of our framework for driving an equitable and inclusive economic recovery for Philadelphia and details many of the efforts that are underway. Economic data confirms what we intuitively know to be true. Philadelphia needs strategic solutions to address major economic challenges caused and in many cases exacerbated by the pandemic. More than 208,000 Philadelphians, including a disproportionate number of minority folks, filed initial claims for unemployment compensation between March 15th and August 1st. That's an average of more than 10,000 per week. Prior to COVID, the average filing was 1,137 people per week. So let that sink in a little bit. Almost 10 times worse in the blink of an eye. About 2/3 of those filing claims had less than a high school diploma. 42% of initial unemployment claimants were filed by Black residents, while 32% were filed by white residents. And that gap that widened as the total number of initial claims filed each week has decreased. Excuse me. In response, we have identified 4 phases of work to drive an equitable economic recovery here in Philadelphia, which will represent a broader citywide effort. The first tenet was to respond, which we did by delivering resources to the most vulnerable businesses and communities and maximizing opportunities to sustain employment. We provided immediate relief to entrepreneurs and employers in a transparent and efficient way to help them make payroll or pay their rent. Programs like PHL Rent Assist, the Small Business Relief Fund, the COVID-19 Fund, and the Worker Relief Fund, and others exemplified our immediate response to help businesses and people alike. Next, in order to restart, we needed to build confidence in the market and in public health safety to drive demand and support businesses as they adapted to new conditions. We provided detailed, actionable guidance and critical resources to entrepreneurs and employers seeking to reopen. With our partners, we provided business support services and programs like the Restart PHL Loan Fund. Through the Neighborhood Business Personal Protective Equipment Program with City Council, we distributed 10,000 PPE starter kits to small businesses on commercial corridors to help them reopen safely. We also kept development moving through online permitting and by moving all board and commission hearings online so they could continue to review and approve development proposals. The city also coordinated closely with PIDC, Philadelphia Works, and community partners to ensure that Philadelphia businesses have an opportunity to access federal and state funding. We continue to advocate for additional relief for our local business community and for all Philadelphians. The next phase of our economic framework are recharge and reimagine. We need to regain the momentum that was disrupted by the pandemic by positioning employers for growth. We must reimagine and reinvent the industries and jobs of the future in ways that increase access and opportunity for all. This will be possible through workforce development, investing in entrepreneurship, especially for entrepreneurs of color, and investing in neighborhoods and commercial corridors that are anchors for our communities. We must enact policies and programs that increase housing affordability. We will continue to invest in community college through the Octavius Catto Scholarship to increase degree attainment for first-time students. And finally, we must close the digital divide through PHL Connected and other efforts. These long-term, large-scale initiatives will help drive Philadelphia's potential to become the most inclusive, livable, and thriving community in the country. So now I will turn it over to Dr. Farley for his update.
Thank you very much, Mayor. I have better news today with case counts being lower over the past few days. Here are the numbers. Since this time yesterday, we've identified 77 new cases in Philadelphia residents, bringing us to a total of 34,886 since the beginning of the epidemic. Since this time yesterday, we identified 0 new deaths from the COVID virus. Our total is 1,763. If you notice, that's one lower than I announced yesterday because we did decrease one with cleaning of our data. Update on our college-associated cases. Around the country, we are still seeing outbreaks in many areas where there are colleges, the colleges and the towns around them. The Temple University outbreak appears still to be subsiding. That's very good news. However, we're still concerned about the potential of spread in other colleges here. So we're asking all the colleges in the area to do what they can to prevent social gatherings amongst their students, which is what appeared to be driving the outbreak that we did see at Temple. A reminder on indoor dining that started 2 days ago here in Philadelphia. We're asking all the residents that are starting up indoor dining to do that in ways that follow our precautions that are on our website. Those include no more than 25% capacity of the patrons at any one time. The diners need to be more than 6 feet away from people at other tables. That everyone should wear masks except when they're seated at tables and actually eating their food. That there's no bar service, no alcohol served except as part of a meal, and the staff need to be wearing masks and face shields for their own protection. If anybody sees restaurants that are not following those standards as they're starting up, please call 311 and we'll send out an inspector. Now on Tuesday, Governor Wolf announced the expansion of restaurants' capacity that he would allow up to 50% effective September 21st. Now, as the city that's been hit hardest by the epidemic, in the past we've said that we will be more restricted than the state if we think it's necessary to protect Philadelphia residents. That's the case now. We've reviewed this proposal and we're not going to be making the change here in Philadelphia on September 21st. However, if the case counts continue to decline and there are no problems elsewhere with the 50% limit, we will consider making that change here sometime in October. I want to talk a little bit about gatherings. And our current limit for gatherings is 25 people indoors and 50 people outdoors. Our experience has been that outdoor gatherings, though, are less risky than indoor gatherings. We have few, if any, reports where it's clear that spread occurred outdoors. We have many examples of spread of the virus indoors, even in some very small gatherings. And there's also, I believe, increasing evidence that the virus may be transmitted through the air. So that means that the air movement that occurs outdoors would be protective. Now, all gatherings create some risk of spread, but if people want to gather, I want to encourage them to gather outside instead of inside. That could be anywhere from a small meeting to a performance to religious services. So we will be increasing our limits of outdoor gatherings from 50 to 150 effective next Monday, September 14th. We will keep the limit on 25 people indoors because we do see indoor gatherings as much higher risk. Now, the important notes here, though. The virus still can clearly be spread by droplets, which can travel whether you're indoors or outdoors. So people still need to keep a 6-foot distance from others when they're gathering outdoors. And that means that, and the virus can still be spread also through the air, even outdoors. So that means that people need to be wearing masks when they're gathering outdoors. And it also means that gatherings involving food and drink, where people are not masked, are still going to be risky, even outdoors. So that we recommend that when people do gather outdoors, that they avoid serving food and drinks. Now, in that context, let me just note that this weekend is going to be the first Eagles game, and everybody's looking forward to that. That's going to be great. Some people may want to tailgate to get together with people to enjoy that game. Let me just point out that getting together in a crowd over snacks is still high risk, even if it's outdoors. So we recommend that people who watch the game do it just with members of your household, not with a group of friends. Now, as the mayor said, the first COVID case in Philadelphia was reported 6 months ago today, on March 10th. So I thought it's worth just taking a little step back and look back at what's happened in those 6 months. We had, as everyone here knows, a very difficult time in March and in April. Initially, testing for COVID was available only at a few sites and only for people meeting some very strict criteria. And the results for that testing took more than a week to get back. So many people who had symptoms had difficulty getting tested at all. Nonetheless, cases that were diagnosed rose very rapidly over the first 4 weeks, from 10 people total in the first week to more than 2,600 in the fourth week after the epidemic first hit Philadelphia. Our hospitals with so many cases came under strain, and on April 24th, we peaked out where there were 1,881 people hospitalized in all the hospitals in the Philadelphia region. With that, deaths from COVID rose quickly as well. In the first 4 weeks, we went from 12 per week to nearly 250 deaths per week. Since those dark times, we've made huge progress. Testing is available in Philadelphia now at some 60 sites, and now we're doing about 3,000 tests per day, and people are getting their results in 1 to 2 days. We're now diagnosing about 700 to 800 cases per week with that expanded testing. Most of those cases are in younger, healthy people who handle the infection pretty well. As of yesterday, there were a total of 175 people hospitalized for COVID in the entire Philadelphia region. That's a decrease of 90% from our peak back in April. And as of the last week in August, we reported only 4 deaths from the coronavirus infection. That's a decrease of 98% from our worst week in April. Now, initially, to slow the epidemic, as you know, we shut down almost every activity here in the city, from schools to stores to restaurants to theaters to all sorts of gatherings. We all had to learn about keeping a 6-foot distance from others. We had to learn about hand washing and hand sanitizer. And most of all, we all had to learn about masks. Since then, we have gradually and carefully and successfully reopened. We reopened stores, then outdoor gatherings and outdoor dining. We reopened barbershops and salons, indoor shopping malls and museums and gyms and schools and colleges. Now, more than 90% of people in Philadelphia, when they go into a store, are wearing a mask. And that mask wearing has enabled us to reopen these activities without seeing a surge of the virus. And during those 6 months, we've had big advances in medicine. We now have better treatments for the coronavirus. The drug remdesivir being shown that it's effective. Dexamethasone is also effective for treating people with serious illness. And convalescent plasma looks like it's helpful for some patients with severe infections. At the same time, we've seen very rapid progress on development of a vaccine against this virus. So that's what's happened over the past 6 months with the progress. Now, what do the next 6 months look like? Well, we expect to continue to gradually restart and reopen those activities that we've restricted in the past, while continuing to reemphasize safety, especially that people need to wear masks. Now, we expect that there will be some temporary setbacks and some reversals, especially as we get to winter, but the long-term trajectory is clearly towards returning to normal. We expect more advances in medicine over the next few months to make the disease more treatable, and we definitely expect more advances in development of the vaccines. I hope that we'll be offering a vaccine in the early months of 2021 in the city of Philadelphia. And it may even be on a limited basis in the very end of 2020, we'll be offering a vaccine to some people. So overall, this has been very rough on everyone, and there's more difficulty ahead, but we are very much recovering. And I know through all that, through those many 6 months, it's difficult for people to maintain the safety precautions, but we need to continue to limit how we get together to avoid more cases and more deaths. More than anything else, people need to wear a mask when they're near others, including that means their relatives and their friends, which is what most of the transmission is occurring amongst relatives and friends these days. This is true for everybody, but it's especially true for people who are vulnerable, those who are over the age of 65, and those people who have chronic medical conditions. For more information on all that we've done and where we're going, go to our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando, who will deliver the Spanish language translation of both the mayor and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el 10 de septiembre de 2020. Buenas tardes. Hoy se cumplen 6 meses desde nuestro primer caso confirmado del COVID-19 en Filadelfia. Durante los últimos 6 meses, todos en la ciudad hemos estado respondiendo a la pandemia enfocados en proteger la salud, la seguridad y el bienestar de todos los residentes. Esta ha sido y será siempre nuestra primera prioridad. Pero a medida que salvamos vidas, aplanamos la curva y comenzamos a reabrir con cuidado, también nos enfocamos en recuperarnos de la devastadora crisis económica que creó la pandemia. Como bien saben, el COVID-19 ha impactado las finanzas de nuestra ciudad, lo que de la noche a la mañana nos obligó a recortar $750 millones del presupuesto fiscal del año 2021. También es cierto que los habitantes de Filadelfia están luchando y estamos al borde de una crisis de la vivienda si es que no continuamos actuando con urgencia para mantener a la gente en sus hogares. Sabemos que las empresas de todos los tamaños han sido afectadas y que algunos sectores se han visto más afectados que otros. Hoy más temprano, desde Filadelfia, la Oficina para Visitantes y Convenciones de Filadelfia y el aeropuerto publicaron una actualización agridulce sobre nuestra industria turística. Muestra cómo el 2019 trajo un récord de visitas a nuestra ciudad y región. Y luego, como la pandemia devastó nuestro sector hotelero y turístico este año, una de las industrias más afectadas ha sido el turismo, con decenas de miles de empleos perdidos. Estoy seguro que junto con Visit Philadelphia, la Oficina para Visitantes y Convenciones, el Centro de Convenciones de Pensilvania y toda la industria hotelera vamos a reconstruir y ayudar para que la gente vuelva a trabajar. Y con este fin, hoy quiero hablar un poco sobre la recuperación económica. Hoy publicamos un informe llamado Responder, Reiniciar, Recargar, Reimaginar, que brinda una descripción general de nuestra visión para impulsar una recuperación económica equitativa e inclusiva para Filadelfia, y que detalla muchos de los esfuerzos que ya se están realizando. Los datos económicos confirman que lo que sabíamos intuitivamente es cierto. Filadelfia necesita soluciones estratégicas para enfrentar los principales desafíos económicos que ha causado y que en muchos casos ha exacerbado esta pandemia. Más de 208,000 habitantes de Filadelfia, incluyendo un número desproporcionado de minorías, presentaron solicitudes de compensación por desempleo desde el 15 de marzo al 1 de agosto. Esto es un promedio de más de 10,000 solicitudes por semana. Antes del COVID-19, el promedio era de 1,137 solicitudes por semana. Esto es algo difícil de asimilar. Aproximadamente 2/3 de los que presentaron solicitudes no contaban siquiera con un diploma de escuela secundaria. El 42% de las solicitudes por desempleo las presentaron afroamericanos y el 32% las presentaron residentes blancos. Y esta brecha se amplió a medida que fueron disminuyendo el número de solicitudes iniciales que se presentaron cada semana. En respuesta, nosotros hemos identificado 4 fases de trabajo para impulsar una recuperación económica equitativa en Filadelfia y que representará un esfuerzo más amplio en toda la ciudad. El primer principio fue responder, y lo hicimos entregando recursos a las empresas y comunidades más vulnerables y maximizando oportunidades para mantener el empleo. Brindamos alivio inmediato a empresarios y empleadores de una manera transparente y eficiente para ayudarlos a pagar sus nóminas o cubrir sus alquileres. Programas como PHL Rent Assist, Small Business Relief Fund, COVID-19 Fund, Worker Relief Fund y otros son ejemplos de nuestra respuesta inmediata para ayudar tanto a las empresas como a las personas. Y luego, para reiniciar, necesitábamos generar confianza en el mercado y en la seguridad de la salud pública para así impulsar la demanda y apoyar a las empresas según éstas se adaptaban a las nuevas condiciones de trabajo. Brindamos orientación detallada y práctica y recursos críticos a los empresarios y empleadores que buscaban reabrir sus negocios. Con nuestros aliados brindamos servicios y programas de apoyo comercial como el Fondo de Préstamos Restart PHL. A través del programa de equipo de protección personal para empresas de vecindarios con el ayuntamiento, distribuimos 10,000 equipos de inicio de equipo de protección personal a pequeñas empresas en distintos corredores comerciales para ayudarles a reabrir de manera segura. También mantuvimos en desarrollo el movimiento a través de permisos en línea y trasladando todas las audiencias de la Junta y la Comisión en línea para que pudieran continuar revisando y aprobando propuestas de desarrollo. La ciudad también coordinó cercanamente con PIDC, Philadelphia Works, y los socios de la comunidad para garantizar que las empresas de Filadelfia tengan la oportunidad de acceder a fondos federales y estatales. Seguimos abogando por un alivio adicional para nuestra comunidad empresarial y para los habitantes de Filadelfia. Las próximas fases de nuestro marco económico son recargar y reimaginar. Necesitamos recuperar el impulso que interrumpió la pandemia reposicionando a los empleadores con miras al crecimiento. Debemos reimaginar y reinventar las industrias y los trabajos del futuro de manera que aumenten el acceso y las oportunidades para todos. Esto será posible mediante el desarrollo de la fuerza laboral, la inversión en el espíritu empresarial, especialmente para los empresarios y comunidades de color, y la inversión en vecindarios y corredores comerciales, que son las bases de nuestras comunidades. Debemos promulgar políticas y programas que aumenten la asequibilidad de la vivienda. Continuaremos invirtiendo en el Community College a través de la beca Ezquerra para aumentar los títulos que los estudiantes obtienen por primera vez. Finalmente, debemos cerrar la brecha digital a través de PHL Connected y otros esfuerzos similares. Estas iniciativas a largo plazo y a gran escala ayudarán a impulsar el potencial de Filadelfia para convertirla en la comunidad más inclusiva, habitable y próspera del país. La recuperación es posible y juntos podremos lograrlo. Gracias. Y esta es la actualización en materia de salud para el día 10 de septiembre de 2020. Hoy comenzamos con buenas noticias, con un conteo de casos menor. El día de hoy reportamos 77 nuevos casos, con un total de 34.886 casos reportados en total. El día de hoy, felizmente, no reportamos muertes por el COVID-19. En total, 1.763 personas han fallecido en Filadelfia a consecuencia de este virus. Debido a un escrutinio de los datos, esta cifra representa una disminución en un caso, pasando de 1.764 a 1.763. Con respecto al aumento de casos asociado con el reinicio de clases en las universidades, continuamos viendo brotes en muchas universidades del país. El brote en la Universidad de Temple parece haberse estabilizado. El conteo de los casos se ha estabilizado o ha disminuido en los últimos días. Sin embargo, seguimos muy preocupados sobre la propagación en las universidades de nuestra área. Le pedimos a todas las universidades del área que hagan todo lo posible para prevenir estas situaciones. Algunos recordatorios ahora sobre el servicio en el interior de los restaurantes. Les pedimos a todos observar las precauciones de seguridad que pueden verse en nuestro sitio web. Con respecto al servicio en interiores, este debe de ser al 25% de su capacidad para cada establecimiento. Los comensales deben mantener una distancia de 6 pies unos de otros. Los comensales deben usar máscaras excepto cuando estén sentados en las mesas. No habrá servicio de bar. Tampoco se servirá alcohol excepto como parte de la comida. El personal que labora en un restaurante debe usar máscaras y protectores faciales. Si usted ve que las personas en los restaurantes o teatros no están cumpliendo con estas recomendaciones, deben reportarlo al 311 y nosotros enviaremos un inspector. El gobernador Wolf permitirá la expansión del servicio en el interior de restaurantes al 50% a partir del 21 de septiembre. Como nuestra ciudad fue la más afectada por la epidemia en todo el estado, nosotros hemos sido más restrictivos que el resto de Pensilvania. Y continuaremos haciéndolo si es que es necesario para así proteger a los residentes de Filadelfia. Nosotros hemos revisado nuestros datos y no haremos este cambio el 21 de septiembre. Si los recuentos de casos continúan disminuyendo y no hay problemas con otros lugares, como el límite del 50%, reconsideraremos esto en el mes de octubre. Con respecto a las reuniones, los límites actuales son de 25 personas en interiores y 50 personas en los exteriores. La experiencia ha sido que las reuniones al aire libre son menos riesgosas que las reuniones en interiores. Casi no hemos recibido informes de propagación en medio de reuniones al aire libre. Pero hay muchos ejemplos de propagación en los interiores, incluyendo en reuniones pequeñas. Hay mayor evidencia que el virus puede transmitirse a través del aire. Todas las reuniones crean algún riesgo de propagación. Pero si la gente quiere reunirse, anímelos a que se reúnan en exteriores, en vez de reunirse en espacios cerrados. Por lo tanto, aumentaremos los límites máximos para las reuniones al aire libre de 50 a 150 personas a partir del día lunes 14 de septiembre. Mantendremos, sin embargo, el límite de 25 personas para los interiores. Hay notas importantes. El virus aún se propaga por gotitas o secreciones. Por lo tanto, aún es necesario mantener una distancia de 6 pies. El COVID-19 puede extenderse a través del aire, incluyendo el aire libre, así que use una mascarilla cuando esté al aire libre. Esto significa que las reuniones que involucren comida y bebida, donde las personas que no usan máscaras se reúnen, sigue representando un riesgo. Les recomendamos a todas las personas que cuando se reúnan al aire libre Eviten comer o beber. El primer caso del COVID-19 reportado en Filadelfia fue hace 6 meses, el día 10 de marzo. ¿Qué ha pasado desde ese momento? Hemos atravesado circunstancias muy difíciles en marzo y en abril. Inicialmente las pruebas estaban disponibles solo en algunos lugares y solo para algunas personas que cumplieran con criterios estrictos. Los resultados tardaban una semana en llegar y muchas personas con síntomas tuvieron dificultades para hacerse la prueba. Los casos empezaron a aumentar rápidamente en las primeras 4 semanas, de 10 casos a más de 2.668 casos por semana. Los hospitales se vieron afectados por tantos casos. El 24 de abril había 1.881 personas hospitalizadas en la región y las muertes también aumentaron rápidamente. Las primeras 4 semanas pasamos de 12 a casi 250 muertes por semana. Hemos logrado un gran progreso desde entonces. Tenemos pruebas ahora disponibles en 60 sitios y ahora realizamos aproximadamente 3.000 pruebas por día. Los resultados ahora se obtienen en 1 a 2 días. Ahora reportamos aproximadamente 700 a 800 casos por semana, incluyendo las pruebas ampliadas. La mayoría de estos casos son en personas jóvenes y saludables que manejan bien las infecciones. Hasta el día de ayer, 175 pacientes han sido hospitalizados, lo cual representa una disminución del 90% desde el pico de esta pandemia. Hasta la semana pasada, la última del mes de agosto, reportamos solo 4 muertes, representando una disminución del 98% desde el pico de muertes en el mes de abril. Inicialmente, para frenar la epidemia, cerramos todas las actividades: escuelas, tiendas, restaurantes, teatros, reuniones. Todos tuvimos que aprender acerca de la distancia de 6 pies, el lavado de manos frecuente y sobre todo el uso de las mascarillas. Desde entonces hemos reabierto gradualmente, con cuidado y con éxito. Las tiendas, primero, luego las reuniones al aire libre, luego el servicio en restaurantes en los exteriores, las peluquerías, los salones de belleza, los centros comerciales cubiertos, los museos, gimnasios, las escuelas y las universidades. Ahora, más del 90% de los residentes de Filadelfia utilizan las máscaras en las tiendas. El uso de las máscaras nos ha permitido reabrir estas actividades sin un aumento en los casos. Y durante estos 6 meses también ha habido avances en la medicina. Hay mejores tratamientos: el remdesivir, la dexametasona, el plasma de convalecientes, y hay avances rápidos respecto a una vacuna también. ¿Cómo serán los próximos 6 meses? Esperamos continuar reiniciando y volviendo a abrir gradualmente. No dejaremos de enfatizar la seguridad, especialmente en el uso de las mascarillas. Puede haber contratiempos y retrocesos, especialmente cuando lleguemos a la temporada de invierno, pero nuestra meta a largo plazo es volver gradualmente a la normalidad. Esperamos más avances en la medicina para hacer que esta enfermedad sea más tratable. Y esperamos también más avances en el tema de las vacunas. Esperamos poder ofrecer la vacuna en los primeros meses de 2021 y quizás de forma muy limitada desde fines del 2020. Así que esto ha sido muy difícil para todos y habrán aún más dificultades en el futuro, pero nos estamos recuperando. Sepa usted que aunque es difícil mantener las precauciones de seguridad, debemos seguir limitando la forma en la cual nos reunimos para evitar más casos y más muertes. Por favor, utilice una mascarilla cuando esté cerca de otras personas, incluyendo familiares y amigos. Esto es especialmente importante si usted es mayor de 65 años de edad o presenta condiciones médicas crónicas. Juntos podemos ganarle al COVID, así que cuida de ti y tus seres queridos y utiliza una máscara. Gracias.
Thank you, Armando. We will now move to the Q&A portion for members of the media. If your hand is raised now for any other topic besides COVID-19, please lower that and we will get to it in the second round, but we will start with questions related to COVID-19. Today, the mayor and Dr. Farley are joined by Acting Managing Director Tumar Alexander. In addition, we also have Acting Commerce Director Sylvie Gallier Howard to answer questions about our Respond, Restart, Recharge, and Reimagine, our framework for equitable economic recovery. We are also joined by Jeff Guaracino, President and CEO of Visit Philadelphia, to answer any questions about COVID-19 and its impact on tourism. And finally, Rob Dubow, the city's finance director, has joined to address any questions related to the city's decision to forego property assessments this year. All of these topics can be addressed in the first round since they are related to the COVID-19 pandemic. And please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. For those logged in today, please use the raise your hand feature under the participants list. We will now begin our questions with those who have their hand raised. Again, if you would like to ask a question, you can use the raise your hand feature found under participants list. We will go to Martin Pratt of Philly YBN.
Yes, this question is for Dr. Farley. Dr. Farley, when will folks be able to visit their elderly family members in senior citizen homes, an estimate? And also any estimate idea when senior citizen centers will reopen?
Yep. If you're talking about nursing homes, the nursing homes are regulated by the state health department and the State Department of Human Services. And so they're the ones that determine when people can, when visitors can go there. I believe that they may be some opportunities now for nursing homes that meet certain criteria, but I'd have to get back to you on that. As far as if you're talking about daytime senior centers where people get together during the day, that is an activity that we're particularly worried about because we're getting very vulnerable people and gathering together indoors. It's the highest risk combination there. I can't tell you when we're going to do that, but it's certainly, we think it's too risky to open right now.
Okay, thank you.
Thanks, Martin. We're going to go to Denise Clay of The Sun. Denise, you just have to unmute yourself there. Denise, we'll circle back. Looks like we're having some trouble unmuting you there. We'll go to Laura McChrystal of The Inquirer.
Hi. My question first on indoor dining. Do you all have any, does the city have any idea sort of how many restaurants are already offering it at this point? I know some weren't going to right away. And how's it going? Has the city been checking out places that are offering it?
Yeah, we did not ask restaurants to notify us if they're going to be opening. We're going to be inspecting restaurants according to our routine. So we don't have any numbers right now on how many of them are offered indoor dining. And it's really just too early. It started on Tuesday. We have sent staff out to educate restaurants and our inspectors are doing their inspections, but I haven't gotten any data back about how it's going.
Okay, and another question for you, Dr. Farley. I'm wondering how contact tracing is going. How many people has the city been reaching, and what are we learning about how the virus is still spreading?
Yeah, I didn't have numbers to update you with today. We'll follow up with numbers on that. I just didn't get the numbers before the press conference. I can tell you in general that we're reaching a lot of people. There's still, I'd say our biggest problem is we have maybe between 20 and 30% of people who don't pick up the phone. And we're working on mechanisms to try to encourage people to do that. When we do get people on the phone, we do get information about their contacts, and we are counseling a lot of contacts. We think that contact tracing was helpful in containing the outbreak at Temple. But outside of that outbreak, I think the biggest learning is that transmission is occurring within households and with relatives and close friends. And that's an important insight, and that's why I've been mentioning that risk to people on these calls.
Okay, thanks. That's all from me.
Thanks, Laura. We are going to go back to Denise Clay at The Sun. Denise, can you unmute yourself?
Can you hear me?
Yes.
Okay. My question was for Jeff in regard to tourism here in the city. Has anyone started talking about next year, and I guess just how bad was it? I guess is the question I'm looking at. Just how bad was it this year?
Thanks, Denise. As the mayor reported, the industry had its best year ever in 2019, and immediately and suddenly, globally, the entire industry just stopped. and it is supporting more than 100,000 jobs in our region, contributing billions of dollars to our economy, and as the mayor mentioned, to the city's fund and the state's fund. The dramatic stoppage immediately impacted every sector of the industry, and it will be a long-lasting impact. But what I do want to say is that in Philadelphia, we are well positioned as a drive destination, as amazing restaurant destination for meetings and conventions and groups to have a robust comeback. We're already seeing that leisure visitors are coming. They want to visit. They want to be here. We knew that 46 million people came last year. This has been an effort for more than 30 years of the city and the region to put people to work and to build our economy. And certainly our mayor has been a champion of the tourism industry. It will take us anywhere to 2023 to 2024 to recover back to the levels of where we were just in March. The industry is united. We thank the administration for their help, one, with maintaining the spread of the disease, which travelers do look to see how destinations are managing COVID, and then also for the continued engagement with restaurants and our hotels and the attractions, critically important for us to get people back to work and to allow people to have things like their weddings, birthday parties, and to take their kids to see Independence Hall, the Constitution Center, and all the things that we love as residents here.
Okay, thank you. Mayor Kenney, this question is for you. It was announced today that Century 21, one of the cornerstone stores of the recently revamped Fashion District, is going to be closing. I guess my question for you is, the Fashion District was just remodeled, it just reopened last year, and the whole COVID shutdown couldn't have been good for it. But are you concerned when you're hearing about not only places like Century 21, but other retail stores that are shutting down, about what this means for the Fashion District itself, especially since it's new and it was just remodeled, and it's kind of hard to fill, it's going to be kind of hard to fill that space because there's not a lot of retail that could fill that?
Well, certainly COVID has affected every sector of our economy, including retail. We're hoping for the best for the Fashion District and get them back as we continue to reopen and more people venture out, feel safe venturing out. We're hoping that the retail, individual personal retail experience will be maintained and expanded. But I also believe, in addition to COVID, the way people shop these days have also affected retail stores. You get a lot of people that are getting stuff delivered by delivery service and shopping over the internet. So we'll have to keep on watching it, make sure that anything we can do to help them to maintain their businesses will be done, as we've done through the course of the COVID pandemic, and we'll continue doing that. I don't have a crystal ball, so we'll see how it goes, and we'll try to help as much as we can.
Okay, Dr. Farley, and this is, I guess, my last question. And I know I should probably know this, but what is the maximum occupancy for indoor events?
25. That's at the governor's level, and likewise here at city.
Okay, so it's still 25. Are there any plans to expand that to allow for more people in an indoor gathering?
We have no plans to expand that right now. The reason we expanded the outdoor gatherings is to encourage people to go outdoors, especially when the weather is nice like as it is. We think people can gather much more safely outdoors, and so we prefer to have that difference as a way of encouraging people to do that.
Okay, thank you.
Thank you, Denise. We're going to go to Jeff Cole of Fox 29. Jeff?
Yeah, I'd like to ask the mayor about the encampment. Will you allow that now?
Jeff, we're not in the second round. We'll come back to you.
Please.
We'll go to Kennedy Rose of the Philadelphia Business Journal.
Hi, everybody. This question is for either the mayor or I see that Sylvie's on the call here. It's about the economic initiatives. I was wondering if you'd be able to provide additional details on just some of these economic recovery initiatives, or just highlight some initiatives to kickstart the economy again. And
Sylvie?
just, yeah.
Sure, yeah, I'm happy to do that. So the report really kind of covers a large number of initiatives that have already happened, and then some of the initiatives moving forward, which right now we're sort of, it's a 4R framework: respond, restart, recharge, reimagine, and we're really kind of in the restart, recharge phase at this point. But as we look forward, some of the things that we're really focused on, we're working through a lot of different collaborations. We're working with the United Way on doing an analysis of our entrepreneurship ecosystem. There was a recent report that came out that said that Philadelphia, we're punching below our weight in terms of the number of businesses per capita, and we really want to find strategies to increase entrepreneurship and to ensure that entrepreneurs succeed. So some of the things that we're doing there, we're looking to create a fund for entrepreneurs of color. We also are launching a mentor protege program for businesses, for construction businesses, to increase the capacity of minority-owned construction businesses. We have an initiative called the Most Diverse Tech Hub, and we're looking to really strengthen the foundation of our economy in terms of preparing both businesses and workforce for the growing tech sector. We know that Philadelphia is a leader in terms of cell and gene therapy, but also that tech is not just a sector, it's really kind of a part of a lot of different industries, and it's an area where we know there will be job growth and there will be business growth. And so we're trying to find ways to position the city so that businesses are prepared for those growth sectors, and so that our workforce is equipped and has the skills to have good paying jobs in those sectors.
Thank you. And my second question is for the mayor. I was wondering, I'm just looking through this report, and I was wondering if you'd be able to speak a little bit on the importance of equitable growth in terms of getting the economy restarted.
Well, obviously, one of the biggest problems facing Philadelphia is our level of poverty, and our level of poverty in communities of color is also quite upsetting. So we have to make sure that we look through a racial equity lens as we recover and rebuild, and that will be a priority for us moving forward.
All right, thanks so much.
Great, thank you, Kennedy. We are going to move to our second round of questions here. Jeff Cole of Fox 29, we'll come back to you.
Okay, I'm sorry there. Here we go. Mayor, are you concerned at all that the city has lost credibility, and you have as well, that there have now been 3 deadlines for the folks here at the encampment to leave, and they have not been, they have not left, and they've not been forced to leave? What good is a deadline if the deadline isn't met and they remain?
Well, the resolution of the protest camps, which began yesterday, is continuing today. This is going to be a multi-day operation. Staff from the Office of Homeless Services, outreach workers from the Department of Behavioral Health, and support staff will be offering services and alternative housing to those at the camps. The city is not wavering from its determination to resolve the protest camps in an amicable way, even if ongoing attempts over several days are needed. As the city remains hopeful that protesters who are currently obstructing the outreach of the city to encampment residents will do what is best for the residents by permitting the remaining residents to explore and obtain services. As we said yesterday, we continue to assess all of our other options. This comes in light of barricades and shields and hostile posture and communications among certain protesters, as well as the serious health and safety concerns caused by the camp. At least one protester has publicly stated that they will use force, and we have evidence that the protesters are stockpiling supplies to aid in their resistance. Such tactics could endanger outreach workers and first responders and possibly precipitate wider violence. The city will use every tool at its disposal to maintain order and to resolve the camp humanely and peacefully. Forcibly removing camp residents will be a last resort.
So have you, because they said that they will be violent, you've said you do not believe, I'm sorry, Mayor, because they've indicated they will be violent, do you no longer want to send the police in to move folks?
We're not saying that. We don't want to send the police in at all. We'd like to resolve this amicably. If we can't, we're reassessing our situation relative to new information that we received by intelligence of what's going on at the campsite. And we're not going in blindly. We want to make sure we go in, if we go in with all the information necessary.
Mayor, they've said they're simply not going to leave, and they've shown they're not going to leave.
Well, we're trying to get all the homeless people out. And then as we reassess our operation, we will determine what to do best as we move forward.
Okay.
Thanks, Jeff. We're going to go to Shaira Arias of Telemundo.
Hi. Okay, perfect. So, Armando.
Sí, buenas tardes, Shaira, ¿cómo estás?
Bien, buenas tardes. ¿Podrías hablar de qué tan realista es esa principal demanda de parte de ellos que quieren que este campamento sea legítimo, legal y que ellos de aquí no se van a mover para otro campamento? ¿Qué tan realista es esa demanda de parte de ellos? ¿Y cuánto tiempo pueden ellos dejar que permanezcan aquí?
Gracias, Shaira. The question has to deal with one of the demands, the first demand that the camps have, which is to have legitimate and permanent presence in those camps. When will they be moved? What will be the time frame for the move for the camps?
Well, the time frame, as I've just said, is fluid, and we're working to get as many homeless people out of the camps as we can, and we're reassessing the strategic part of ending the encampment if we have to do it with police.
Como dije anteriormente, nosotros tenemos una situación fluida en nuestras manos. Estamos tratando de sacar a los sin hogar del campamento de la forma más posible que podamos lograr y estamos en un proceso de desarrollar una nueva estrategia para saber cómo podemos resolver este tema.
If I could add something, we've actually placed 142 people now who had been at one of the protest camps in housing, which we've already previously described, our COVID prevention space, some in various forms of residential treatment, as well as some in shelter, as well as creating a program to provide rapid rehousing straight from the street, which is underway as we speak. But we don't know how many homeless individuals actually remain in the camps because we have not been given access by organizers to actually go in, meet with them and assess what their needs might be.
Eva Gladstein nos agrega de que en realidad ya hemos reposicionado a 142 personas que estaban en uno de los dos campamentos de protesta en alojamientos que habíamos descrito previamente como lugares de espacio de prevención del COVID-19 y en otros tipos de centros de tratamiento residencial, asimismo como albergues. También hemos creado un programa para darle un reposicionamiento rápido a aquellos que están en las calles y se está desarrollando en estos momentos, pero no sabemos exactamente cuántos individuos sin hogar se encuentran en estos campos porque los organizadores no nos permiten acceder a esa información.
Now, I understand that the mayor has said this in English, but we haven't had it in Spanish so far. So if you could please, le puede preguntar cuál es su sentir para él de ver de que él ha tratado de hacer esto de una forma amigable y que ninguno de los tres intentos le han resultado a la ciudad. Al igual, pregúntale, yo entiendo por qué no pueden desalojar a las personas de aquí, pero por qué la policía no puede quitar lo que es las barreras que han colocado en la calle. O sea, son dos preguntas en una, pero ¿por qué la policía no puede quitar las barreras y el sentir de él sobre todo esto?
It's a two-part question for the mayor. Mayor, question number one is, what is your feel about your friendly attempts to try to resolve the situation? There's been 3 tries, and the second part is understanding that it's difficult to remove the members that are in those camps. Why isn't the police removing the barriers that they've placed in there?
First of all, it's not 3 tries. We've been trying for 3 months. And we've been successful in getting, as has been said, 142 people into shelter or recovery or some safe place to be. I'm not going to talk about strategy when it comes to police, nor a date or a time when it may happen. And I think that would not be in the best interest of our first responders and police to let that out before we do it.
No han sido solamente 3 intentos, sino han sido 3 meses en los cuales hemos tratado de resolver este tema. Y como ya se mencionó, hemos reposicionado a 142 personas de forma segura en albergues, pero tampoco es conveniente para mí en estos momentos el revelar la estrategia que nuestra policía pueda tener, dando una fecha o la manera en la cual se va a resolver este tema. Nosotros vamos a seguir haciéndolo y vamos a seguir monitoreando la situación también.
Thank you.
Thank you.
Also, just a note, we did drop the breakdown of the 142 placements in the chat for those that are logged in. Next, we're going to go to Martin Pratt of Philly YBN.
Yes, this question is for the acting commerce director or the mayor. Pew Institute put out a report in August, I believe it was, of 2019 that said that Philadelphia job growth is not closing the gap between residents of Philadelphia and non-residents. There's an increase in lower paying jobs, but there has not been an increase, and they suggest it will not become an increase in Philadelphia residents to being trained to be able to handle higher paying jobs. So with the Reimagine project, my question really is what, we know Amazon is trying to open a store here in Philly where there won't be the retail person in the store. There will be a lot more high tech. How is the workforce part of that Reimagine being positioned? And additionally, we're becoming an esports hub. Where does esports fit in this?
Sure.
I don't know much about esports, but we are continuing, just for example, the Hillco project down at the old refinery will be an opportunity for 14, 15 million square feet of warehouse space that can physically employ individuals without a college education, making between $20, $30 an hour, working in those potential fulfillment centers for large online retailers and others. Also, the expansion of the Port of Philadelphia through the synergy between Hillco and our port, also our railroads. I mean, there's lots of things that are happening or going to happen that will allow for employment at a decent paying wage scale for folks who are unemployed or underemployed at the moment.
And if I could just add, Mayor, well, one of the barriers that we also face is that minimum wages is set by the state. So that is one of the reasons we have a lot of working for. But in terms of the workforce division that is part of the Commerce Department, one of the things that we're doing more and more is connecting businesses. So as we do business attraction, or as we're working with businesses that are growing, we are connecting them to workforce development providers, so that those providers are matching up the skill sets that the employers need and helping those that need opportunities to get those types of jobs. And as I mentioned earlier, we have an initiative around creating, making Philadelphia the most diverse tech hub. Part of that is having an industry partnership. So having a network of dozens of companies that are in particular industries working together on how we diversify the workforce and how we provide more opportunities. There's an industry partnership we're creating around tech. I know that the Chamber is building an industry partnership in collaboration with Philadelphia Works around cell and gene therapy to diversify and create more opportunities in that growing sector. And then there's a few other industry partnerships that Philadelphia Works runs. So, that definitely imagining jobs of the future and how we deal with the new types of jobs that will come out of automation is part of the reimagining portion of the plan. And e-gaming is something that we're looking at as well. That is something that I know that the private sector is certainly growing, but it's something that we need to explore more as well.
The last question is, FanDuel and DraftKings have said they want to make Philadelphia the sports betting capital of the world. Any comment on how this will fit in, or is the city itself saying, good luck, but we're not necessarily interested in being known as the sports betting capital of the world?
I mean, I've not really entertained any of that at this point. Certainly, if they're welcome to come in and run their business in Philadelphia, we love to have them here. I mean, it's odd for me at my age because I remember sports betting used to be illegal, and now the state is in it, full blaze. So we'll see how it pans out, and any business, including esports, that wants to deal with interact with us for assistance and guidance, we'd be happy to do so.
Thank you.
Thanks, Martin. We're going to go now to Maggie Kent of 6ABC.
Hello, good afternoon. My question is about the encampments as well, but it focuses on some more specifics. One interesting point that I heard today from the members who are staying at the encampment is that they haven't heard from anyone today in regards to what they would like to see happen, which I don't know is 100% true. The second being, one of the proposals that they have is to have a community land trust where they would be able to repair and fix up some of those PHA houses and also use some of the vacant lands to then build on. And I think what some of the organizers have been saying is that they really are asking for some creativity and maybe things that you've never seen or done before in the city in trying to come to a solution, because they feel as though the shelter beds just really aren't a permanent solution, and they're not necessarily a safe place for them to be at this point.
It's according to talking to part of the overall problem has been that there's really no specific leadership at that site. We've met with scores of people over 3 months. We've had all kinds of requests that we've tried to fulfill, and when we fulfill them or pledge to fulfill them, then the requests or the demands change again, and the goalposts get moved further and further away. The bottom line is that shelter is a pathway to permanent housing, and you simply can't. A lot of people in those camps are either addicted individuals or people with mental health or mental health issues or both, and you simply can't hand a set of keys to a house to a person who has all those additional needs. So there's a process that we want to undertake. We were willing to set aside, I think, 60 different properties or so for them to have a nonprofit to start fixing up houses, and we committed to doing that. And then they changed the demands again. So there's really no specific leader or leaders. Everybody has an opinion, and it's hard to accommodate people with multiple opinions that keep on changing those opinions almost on an hourly basis.
If I could just add, we agreed to help support a community land trust. I haven't gone through the process of establishing one. When the Housing Authority agreed to post 62 properties that group or others could get through a registration process, which is a new and creative and innovative thing the Housing Authority has never done. The Housing Authority asked for their commitment that they would not start squatting immediately in those properties, because what's the purpose of posting them for availability if then they're going to put folks into squat? They refused to provide that agreement that they would not squat in those 62 properties. So the Housing Authority is still going through with this process for making those 62 houses available, but has had to use a different methodology, because sitting in a meeting with camp organizers, they refused to commit not to and immediately take over those properties.
And those properties would be available to be fixed up, I guess is my question.
Yes.
62?
Yes, they were available to be fixed up and used for, residential uses. And the posting is still on the Housing Authority's website, I believe.
Maggie, I'll just add that we are still continuing to look for a resolution and engaging those folks. There was some activity today, there'll be activity tomorrow. So we haven't stopped that process.
Thank you all for your time, appreciate it.
Thank you, Maggie. We're gonna go to Alicia Reed of CBS 3.
Hi, good afternoon. This question is for the mayor. So the encampment now extended, they have 22nd in the Parkway barricaded also on the Spring Garden side. And this is not only hindering traffic, but stores yesterday were closing down early. Today Target's boarded up. And so the question is now that, for example, some of the stores that closed down yesterday, people lost wages because they had to go home. What is your response to that, Mayor, now that it's affecting other people's livelihood?
It's affecting everybody, and I do regret the fact that people's livelihoods are impacted, but we have to make sure we proceed with caution and proceed as safely as possible. And we're not on the timetable of the media.
Thank you, Mayor.
Thank you. We are going to go now to Lauren Meek of NBC 10.
Hey, everyone. I first want to pick up on the last part of Maggie's conversation talking about communication with folks there, because I did hear somebody say today that they were willing to take the barricades down if the mayor and the city restarted negotiations. Do you consider yourself to be still negotiating with them?
Well, at the moment, no, because it's hard to negotiate with people who can't set a set of guidelines that they stick to. We've had numerous meetings and we respond to them in kind. And then those requests or demands change. And then we're back where we were again. I mean, I'm willing to talk to anybody. I had two personal conversations with the organizers myself. I mean, we're not looking for trouble. We're just looking to respond, be safe, and get this over with, get this encampment over with. We're willing to do that today, but I don't think I think there are elements within the camp who care less about homelessness and are simply a political statement that they want to make.
I know that you have said previously that you would continue to try to get people to voluntarily come out, entice them to come out, and do not want to use force. What is the tipping point? Does something have to happen specifically to make you decide it isn't time to go in, or could you just reach a length of time that you don't feel it's appropriate for it to be there anymore?
Well, it's not appropriate for it to be there now, but we're trying, again, this is a very, very sensitive and heightened situation in our whole entire country. And, to plow in there without thinking about it and planning for it or continuing to negotiate for it would be irresponsible. We will get to at some point where the encampment will be ended.
Will they get a final notification or warning before law enforcement would show up?
I'm not going to talk about that. We've posted a number of times. It's very clear to those in the camp that we want the camp to expand, and we'll move forward as well as we can and as safe as we can.
And it's certainly our intention, Lauren, it's certainly our intention to keep acting on this recent posting, right? So we haven't stopped letting those folks know that they can't be there and that we want to offer them services for them to come out of that. I think the mayor, every other comment the mayor made was correct. Mayor Ann even made was correct regarding actual homeless residents, and it turned into more of a protest encampment. So we haven't stopped trying to resolve this encampment.
And actually, let me follow up on that just quickly, because I'm sitting here, I'm looking at it right now. I don't see visible police presence. I don't see people necessarily around the edges walking up to it to engage people. Is there stuff happening behind the scenes that we can't see?
I'll just share that homeless outreach was out there this morning. They're generally out there like 9 or 10 till noon or so. And I got a report at 10 a.m. that a few additional individuals were coming into housing placement. So they may not be there now, but they were certainly there today.
Thank you.
Okay, thank you, Lauren. And seeing no further questions, that will conclude our briefing today. Thank you.